Let's end with the person who is experiencing the pain and the suffering of a new symptom that feels serious. And there's this array of possible treatments or diets or medical routes that confront me. What's your advice?
I think a lot does depend on the problem that you got. I mean, there's still value in making a diagnosis, because in the world that we live in today, you do need to know whether you've got a cancer or whether you've got some kind of what people call a serious disease. We do need to have that as a foundation upon which to decide where to go next.
Okay.
So probably the best person would be to go to your GP.
Yeah.
Because you actually want to know what's going on, what the diagnosis is.
Get some tests done.
And
possibly.
get some tests done, because they are the specialist
Yes.
in disease diagnosis.
Okay.
So, that's where you want to go to first.
It's a bit like with my car.
Yes.
There's no point ignoring the fact that something has just gone bang under the bonnet.
Yes.
So take it to somebody who's going to say, it's this that's gone bang.
Yeah. You want to know what the situation is. Have I got something that's really an emergency situation that needs to have adequate treatment to? And the best people for emergency treatment is your local hospital or your specialist.
Yeah.
But once you have a diagnosis, the question is what you do with the diagnosis. There's where the problem starts to come in, because who'd you go and see then? Well, a lot does depend on the kind of diagnosis. If there's no disease and the doctor says, I can't find anything wrong, but you say, but look, doctor, I'm exhausted, I can't sleep at night, I've got pain all over my body. Yeah. And he says, there's nothing there. So what's going on then? Yeah. Well, straight away you need to know that you don't have a disease. But what about the dysfunction?
Yes, okay.
So if there's no disease and things haven't broken, then you're not in that part of the model which needs to go to somebody that can fix the part that's broken, if it can be fixed.
Yes.
If it can't be fixed and it's got a disease label, well, no, that's one thing. But if there's no disease label, and you're still not right, then you're in the dysfunctional aspect of that process. Yeah. Then you need to go to somebody who's a specialist in dysfunction.
Yes.
And that's not a medical doctor. Yes. Not a conventional medical doctor.
A specialist in dysfunction that's a concept I'm not familiar with, but I am now, having talked with you.
So who's a specialist in dysfunction? Well, there's a whole range of integrative doctors. You might want to go see an acupuncturist. You might want to go to a Sangoma. You might want to go to a homeopath. All those are the people that are specialists in dysfunction. Mm-hmm. I love integrative medicine because that's what I do. That's what I am, is an integrative doctor. And there are lots of integrative doctors, and there are good integrative doctors and not so good integrative doctors. You've got to find the one that you feel is the one that you can work with. So you need to find the kind of practitioner that works with the area that the problem is in. Now, sometimes, if you've got a serious disease, you may need to work with a doctor and an integrative doctor and a acupuncturist. If you just got a back pain, for me, the treatment of choice is acupuncture.
Okay.
If you've got hormonal problems, you might want to go to an integrative doctor that specializes in bioidentical hormones, which are more natural hormones. Uh-huh. So a lot depends, because now you've got an open field. You've got to make a decision around what you want, but you need to know what the problem is.
Yes.
So, as I said, we got these different aspects. If you don't have a disease, but you're only dealing with a dysfunction, remember that the dysfunction is not just matter dysfunction. It's matter, energy, information. So if you want to deal with the energy information, you want to go to an acupuncturist, because they're specialists in energy movement, in opening up the channels. Yeah. So a lot depends on how you want to view the whole situation.
You're painting a picture for me of a sort of ecosystem of specialisms, but there's a particular sort of overlay, which I'm hearing is the speciality of the integrative doctor, which is to be able to see the landscape that starts with healthy function and moves through cause to dysfunction to symptom to disease, and someone needs to help me, the patient, locate myself accurately in this landscape so I know what sort of help is likely to be beneficial. And it probably will be a mixture at different times of different practitioners.
So an integrative doctor might be the best one to go to, because he might say to you, well, I think that you need to have energy work done. Well, energy work, when you're talking about energy work, there are lots of people that deal with energy work. There are so-called healers, there are people that deal with touch therapy. So there are lots of energy healers around.
And I'm mindful of what we were saying earlier about the story, changing your story and stress and so on, because then there's the whole psychotherapy field
and
as well, that if you're actually dealing with something that, some relationship trauma that's never been processed, again, that's another piece of the landscape that needs to be.
So it is complex, and I'm not saying it's not complex, but all I'm saying is that you need to see the field that you're dealing with. And when you talk about the ecosystem, it's true. There are lots of things which we're dealing with: body, emotions, mind, spirit, matter, energy, information.
Yeah.
At what
level? The way you rattle those off. Those are clearly very familiar ladders.
So because you're dealing with all those aspects, of, you're not just dealing with a body.
No.
You're dealing with a human being. And a human being is an ecosystem of many different proportions, and where you want to come into that space depends on what your feeling is, what seems coherent to you, what seems to work. It is a magical process. And that's why I love the word alchemy. Because alchemy, I think of myself as an alchemist in a kind of way. You know, how do you add this and a bit of this and a bit of that?
What's the difference for you between an alchemist and a chemist?
An alchemist is something to do with a more esoteric, spiritual, energy side of it. A chemist deals with chemistry. My definition of medicine is that medicine is an art that uses science to measure what can be measured. But most things about human being can't be measured. We can't measure emotions, mind, spirit, soul. And none of those qualities, energy, we can't measure. So that's why it is an art. It can't be a science.
I love that, an art that uses science.
Uses science to measure what can be measured. And only a small part can be measured. Most of a human being can't be measured.
But what can be, measure well.
Can be measured. You know, by chemistry we can measure. But energy information we can't measure. So that's why medicine is an art, and it can't ever be a science. Not possible.
I heard it here first. It makes absolute sense to me the way you describe it, and I'm just aware of how heretical that would be in the ears of so many people, because science is the highest art that we think we've acquired.
But we know now that that's not true.
We ought to know that.
Quantum science has shown us that you can't ever know. You can't measure the particle properties and the wave properties of light at the same time.
So
you can't do it.
So it runs out of road.
There are limits to what science can know. And that's important to recognize that, so that we learn to trust our feelings and our intuition as well. We have to do that.
And I was thinking, when you were describing this sort of landscape and the ecosystem that the patient must engage with, that trust is another element. And you use your intuition as a patient to follow the practitioners where you feel you can build trust. Because often, I mean, I know this from my own experience, I can't follow, I don't know the fields of knowledge that I'm asking someone to articulate to help me solve my problem. But if I feel I can trust this person, then I'll give them some time, attention, and some money to work with them. Where does trust fit in?
I mean, that's a difficult one for me, because one of the problems today is that people trust medicine too much, trusting what the medical specialists tell us. And, one has to be careful in that, So I think people need to take responsibility for it.
I hear what you're saying about trusting inappropriately.
Yes.
But unless you've got alternative knowledge against which you can compare, well, what this person or institution is telling me, but I'm hearing a different story, now I can take responsibility for choosing. But for a lot of people, they don't have access to that alternative.
I'm hearing you, but I think that in the end, people do need to take responsibility for what they decide to do. Trust is a difficult one for me because trusting means that the person knows what they're talking about. It's like weather prediction. Why is it still called a prediction when you've got thousands of satellites up in the sky and we still talk about a prediction? Prediction means that it's a guess. You're using information that you can collect, and yet you're still talking about a prediction because you can't know everything.
Yeah. Maybe we're getting at odds because of two different interpretations of the word trust, because
Yes.
for me there's a healthy form of trust where I actually open up to what a person can give me, a practitioner can bring me.
Yes.
But I haven't abandoned my critical faculties.
Yeah.
There's another sort of trust which is you might call it a more blind trust, where if he's got a doctor in front of his name
Yes.
and so on, then I sort of lie on my back and spread my legs and tickle my tummy.
Yeah.
I've abandoned my critical faculties.
And I honor that, but I just know that one of the biggest problems we have in medicine today is that there is a kind of arrogance. And that applies
Sure.
right across the
Sure.
board. I'm not saying everybody thinks that they know the truth. And the point that I keep pointing to is how little we actually know.
Yeah.
Because we
Yeah,
know
sure.
quite a lot about matter, but not about energy, information, consciousness.
Yes.
And
yes,
yet,
yes.
that energy, information, consciousness is really what makes us human, what gives
Yeah,
us
yeah.
the beingness that we are.
Yeah.
And yet, that is a total mystery.
Yeah.
We don't understand consciousness, we don't understand energy, we don't understand information, and we can't measure it. So I think there needs to be an enormous amount of humility in medicine, coming both from the practitioners, but also from the patients. We're
That's
always in that
really-
space of not knowing.
Yeah.
And we need to together negotiate through this jungle carefully,
Yeah.
humbly.
Yeah. No.
It's just that as we keep moving, things shift, and then we need to take the next step and make a decision about it.
Yeah.
And trust that what we're doing is the best we can do at the moment.
Yeah.